Have you ever wondered if our bodies could heal themselves from almost anything? What if we could regrow damaged tissues, repair worn-out organs, and even reverse the effects of aging? It sounds like science fiction, but this incredible power might be hidden within our own bodies, locked inside tiny, remarkable cells called stem cells. Today, we're diving deep into the world of regenerative medicine, exploring how these microscopic marvels are not just the future of healthcare, but are already changing lives today. They are unique, unspecialized cells that have two superpowers. First, they can divide and replicate themselves over and over again. Second, and this is the truly amazing part, they can differentiate. That means they can transform into any specialized cell the body needs, like a heart cell, a brain cell, or a bone cell, or a bone cell. It's like having a universal spare part that can become whatever is required to fix a problem. There are several types of stem cells, and you've probably heard of a few. Embryonic stem cells, found in the earliest stages of development, are what we call pluripotent. This means they have the potential to become any cell type in the entire body. They are incredibly powerful for research, but their use is also a topic of ethical debate. Then we have adult stem cells, which are found in various tissues throughout our bodies, like bone marrow, fat, and even our skin. These are typically multipotent, meaning they can develop into several, but not all, types of cells. For example, a stem cell from your bone marrow can become a red blood cell, a white blood cell, or a platelet. For decades, the most well-known use of stem cells has been bone marrow transplants, which are essentially stem cell transplants. They've been used to treat blood cancers like leukemia and lymphoma for over 50 years. By replacing a patient's diseased bone marrow with healthy stem cells, we can essentially reboot their entire blood and immune system. It's a powerful and life-saving procedure that has paved the way for so many other discoveries. But the field has exploded far beyond that. Scientists are now exploring how to use stem cells to treat a huge range of conditions. Let's talk about some of the most exciting areas. Take heart disease, a leading cause of death worldwide. When someone has a heart attack, part of their heart muscle dies and is replaced by scar tissue, which can't pump blood effectively. Researchers are experimenting with injecting stem cells directly into the damaged heart. The hope is that these cells will differentiate into new heart muscle cells, repairing the damage and improving heart function. Early clinical trials have shown promising results, offering a glimmer of hope for millions. Then there's the world of neurology. Diseases like Parkinson's and Alzheimer's involve the death of specific types of brain cells. For Parkinson's, it's the dopamine-producing neurons. Scientists are working on ways to grow these specific neurons in a lab from stem cells and then transplant them into the brains of patients. The goal is to replace the lost cells and restore normal function. This is incredibly complex, as the brain is our most intricate organ, but the progress being made is nothing short of breathtaking. What about something more common, like osteoarthritis? This is the wear and tear arthritis that affects millions, causing joint pain and stiffness as cartilage breaks down. Current treatments mostly manage symptoms, but what if we could regrow that lost cartilage? Stem cell therapy is being used to do just that by injecting stem cells into an arthritic joint like a knee. Doctors aim to stimulate the body's natural repair mechanisms, reduce inflammation, and potentially generate new, healthy cartilage tissue. Many athletes have turned to these treatments to speed up recovery from injuries and prolong their careers. Even our vision could be restored with stem cells. Macular degeneration is a leading cause of blindness in older adults, where light-sensing cells in the retina die off. Researchers are now conducting trials where they grow a thin layer of retinal cells from stem cells and surgically implant it into the patient's eye. In some early cases, patients who were legally blind have regained enough sight to read and recognize faces again. It's a testament to how this technology can restore not just health, but quality of life. Another fascinating area is the use of induced pluripotent stem cells, or iPSCs. This was a Nobel Prize-winning discovery. Scientists found they could take a regular adult cell, like a skin cell, and reprogram it in the lab to turn it back into a stem cell. This is a game changer. It means we can create powerful, patient-specific stem cells without using embryos. We could take your skin cell, turn it into a stem cell, and then use it to grow new tissue that is a perfect genetic match for you, eliminating the risk of immune rejection. This also allows us to model diseases in a dish. We can take a skin cell from a patient with a genetic disease, create iPSCs, grow the affected tissue type in the lab, and then study the disease and test potential drugs on those very cells. Now, with all this incredible promise, it's also important to be realistic and cautious. Regenerative medicine is still a developing field. While there are many legitimate clinics and research trials, there are also unproven and potentially dangerous stem cell treatments being offered. It's crucial for anyone considering these therapies to do their research, consult with trusted medical professionals, and look for treatments that are backed by solid scientific evidence and regulatory approval. The science is real, but the hype can sometimes get ahead of the reality. So, what does the future hold? Imagine a world where waiting lists for organ transplants are a thing of the past because we can grow new organs in the lab. Imagine healing spinal cord injuries and giving people the ability to walk again, or treating diabetes by growing new insulin-producing cells. This isn't just wishful thinking. These are the goals that thousands of scientists around the world are working towards every single day. The building blocks are the stem cells that reside within us all. Stem cells represent a fundamental shift in medicine, moving from just treating symptoms to truly regenerating and repairing the body from within. They are the ultimate form of personalized medicine. The journey is long and there are many challenges to overcome, but the potential is limitless. We are standing at the dawn of a new era in healthcare, one powered by the incredible regenerative capacity of our own bodies. The future of medicine is not just in a bottle or a pill, it's inside of us. Thanks for joining me on this incredible journey into the world of stem cells. It's a field that's constantly evolving, so if you found this fascinating, make sure to like, subscribe, and hit that notification bell so you don't miss our next deep dive into the science that's shaping our future. See you next time.